He's not looking.
You can't take a picture. You keep your answers because it changes every time.
All right,
You get him to.
face and neck injuries. Your thought for the day. Failure will happen. Hopefully you're getting used to that. Bad things are gonna happen. Hopefully you're getting used to that too. You're gonna see a lot of bad things in emergency services. Matter of fact, if bad things didn't happen, we wouldn't need emergency services. What we do after a bad thing happens, when failures happen, what we do afterwards, is what makes us or breaks us. Change the failure that already happened. You can't change the bad thing that already happened, but you can change what happens next. Any questions? You can be proactive or you can be reactive. Choice is always yours. So we're gonna learn about the anatomy and physiology of the face and the neck. Things that cause obstructions to the airway, the different types of facial and neck injuries. And we're gonna go over the assessments and treatment steps of said facial and neck injuries. That is the skull and the top of the spine. What's that vertebrae's name? Ah, you guys. Any questions? All right, how do face and neck injuries happen? Breakdancing, that's how. And Russian dancing. Watch your kids, watch your kids. All right, the anatomy of the eye. So your eyeball into its humor, it's like a jelly. It's not replaceable. You lose it, your eye's dead, you're blind, you never see again. Got your lens, your pupil, your cornea, your anterior chamber. You need to know all these things. Your retina, your sclera, your conjunctiva. You need to be familiar with all those things to pass the tests. Everyone takes vision for granted until they don't have it, then it's life changing. Any questions? Ooh, eye injuries. So yes, that's a real picture. It's the nail to the eye. Nailed it. So anyway, so when you get an impaled object to an eye or a damage injury to any eye, you secure the impaled object in place and you cover both eyes because your eyes work together. If you start looking around with the other eye, it's going to tear the living hell out of the globe of that one eye. You're going to lose all your vitreous humor. So yeah, it's ugly stuff. So always cover both eyes. Secure it in place, make a little donut around your pinky, put the donut secured in place, cover both eyes. Any questions? So eyes. Sclera should be white, pupils should be equal, round, and reactive to light. Light, not light. That's called pearl. Pupils equal, round, reactive to light. PERRL. Pearl. It should move in the same direction. Should be able to track your finger. Pupils should constrict when light shine in them. Dilate. Any questions? Why do pirates wear a patch? That's a good EMT question. Nobody knows. So you go quickly, go up and above, they switch the patch. So you have one eye dilated, one eye constricted. So then they run downstairs, you switch the patch over to the other eye, they can see immediately in the dark. That was the reason why they wore patches. Any questions? How do you make a donut? You have to go over to police academy or whatever. Just kidding. Anyway. Deep fried dough. Take a gauze, wrap it up around a finger. Make a donut. That's how you secure impaled objects. Any questions? Not a very realistic photo, but it'll work. It's the best I could find. Any questions? Don't throw pencils and flats. So what do you do for an eye injury? You got to get them to an ophthalmological surgeon. This, I believe, is a fish hook. I'm sure it's in this case. Got something in there. Ugh. Not fun. Better hope your surgeon doesn't have shaky fingers. Ugh. Any questions? Gotta be really skilled to do that. Sewing an eye back together.
I got a question.
Yeah,
So the people like push out of the laceration,
I didn't see that.
the iris, I mean,
Iris might have, yeah.
does it reform or you probably don't know?
I have no idea.
Okay.
I am not an ophthalmological surgeon.
Yeah.
Chemical burns, also very, very bad. You gotta flush for about 20 minutes. Chemicals, heat, light rays, if we have to all go out the back door right now and go watch the welding, you'll get light burns. Any UV rays, or just look at the sun. Trying to catch the eclipse. So the UV light ray burns feel like someone rubbed sandpaper against your eyeballs. Very, very painful. Chemicals, again, you just gotta wash with a constant flush for another 20 minutes in an eye wash station if you have one available. Then bandage both eyes. Any questions? Thermal burns, you get like heat to the face, can also do it. Again, moist sterile dressings. Wrap them up, get them to a hospital and then transfer to a burn center. Any questions? Light rays, same thing, nothing you can do. Put pads over it. They're gonna be in intense pain, but nothing in the field you can do about it. Any questions? Lacerations are gonna be ugly. Face is very vascular and it bleeds a lot, but usually not life-threatening bleeding. Just distracting injury that makes things look just absolutely awful. That's brutal. Very unattractive also. Any questions? Maybe this one's the fish hook. No, this is a knife. Stabbed in the eye. Ah. You guys will be expected to do this in the field. No, it's not true. Oh. I can't even imagine. Hope the guy's unconscious while we're doing this. Nurse walks in the room, he looks the other way. Got that egg in there. All right, you guys get the idea? All right, blood trauma. So this is more common what you're gonna see is blood trauma. And probably most common what you're gonna see is blowout fractures, retinal detachment, you might see, but it's less common. Retinal detachment usually you see from major deceleration injuries. Like you're in a vehicle that travels from 60 to 0 instantly. Like it's a tree. But blowout fractures are usually from trauma, bar fights, skiing. Things like that, domestic violence. And what it is, the tendons that are attached to your skull, to the facial bones of your skull, that's how your eyes work back and forth. But when you break those bones and the tendons have nothing to work against, so you get a blowout fracture, so the eye goes. Now, retinal detachment, it's associated with deceleration, trauma deceleration, but the decelerating trauma. What you'll see is one of the key symptoms of that is, so if you shut your eyes real tight right now, you'll see floaters, little colored lines. They'll start seeing floaters stop closing their eyes. That's a sign of a retinal detachment. Now, if they haven't had deceleration trauma or any trauma, and they have a horrific headache and they're seeing floaters, that's a sign of a type of stroke called an AVM. That's also a critical emergency, but we'll go over that in strokes after midterm. Any questions? Any questions about blowout fractures? Any questions about retinal detachment? Hypemia, that's when you start getting blood starts filling in the anterior chamber. That's actually a real picture there on the top. Any questions? Usually blunt trauma, ruptures of vessel inside the eye, or bleeding into the anterior chamber.
I know with these, we cover with the whole vascular with these two.
Yeah, always cover both eyes. Cool thing about this is you got the paper colored contact ones to change your eye color, just turn to red. Any questions? There you go. See how the eyes are going different directions, blowout fracture. But generally though, that's a fake picture though, because the blowout fracture, look, that face is perfect. You didn't have ecchymosis and abrasions, and it never looks like that. Swelling. That face is completely intact, so there's nothing there that's blown out. Any questions? Oh, sports, yeah, any deceleration. You also get sports injuries when you get rapid head trauma. Smack that. Any questions? Retinal attachment serious. So another thing that's not really an eye injury, you're gonna learn about in the next chapter that we do, the next presentation, which will probably be tonight, is that there's intracranial pressure on one side, it'll cause the pupil to dilate. It's not actually an eye injury, it's an injury to the brain. But it shows up by the pupil dilated, they call it a blown pupil. And if someone has a pupil that's not reacting to light, make sure it's not a prosthesis. Ask them, do you have a glass eye? Any questions? We got some really good glass eyes now. You can't tell the difference. That's a blown pupil. The one on the left. Well, you're right, patient's left. Any questions? Contact lenses. So generally, we don't try to remove contact lenses. The only times that there's a chemical burn, then if the patient's awake, they can usually help you or they can get it out. If not, you'll have to remove it, which we try not to do that. Soft lenses, you can usually use a Q-tip to get it out, have them blink. Hard lenses, same thing, they should be able to blink and then pinch and it should be able to come out. Any questions about contact lenses? Injuries to the face. So of course, the biggest thing you gotta worry about is airway, broken teeth, pieces of flesh and blood draining into the airway. Again, distracting injuries, injuries to the face are usually brutal, very, very unattractive. Yeah, that's pretty good avulsion. All right, this is the one they were asking about. You guys ready for this one? This is a good one. The video is not that good, but pretty brutal. Come on. You gotta be over 18. You gotta go, U10. That was Van Halen, by the way. See, you thought something bad was gonna happen. That was a perfect diet. That wasn't. Good thing they were screaming, that helped him a lot. Yeah. So they got an endotracheal tube straight into his airway though. Still alive. Maybe so you can put his face together, you can see his face. It's gonna leave one hell of a scar. He's not only is he alive, he's breathing on his own. He's breathing out his own ET tube. They're not even ventilating now. Any questions? That's a pretty good facial injury. Don't get much better than that. This is a good one, Tim. But slow down, slow motion, you can see how good it really does. Watch your C-spine. Have it so bad you don't really see it.
Nehoda sa obišla bez vážnejších
We'll slow it down for you.
Museli niekoľkými stehli zašiť tržnú ránu na hlave. Davisova si okrem toho poriadne ubrela v prípade hlavu a z nosa jej tiekla krv. Na pomoc jej okamžite priplávali
Oh.
venery. Mladá skokanka však bola aj v momente, keď ju vyťahnuť
Ouch.
na privedomí. Po vyšetrení lekárom sa pre ňu šampionát predčasne skončil.
Yeah, that's not good. All right, hematomas has blood collecting under the skin. The face is very vascular, so hematomas do happen. That's a good one right there. That's probably a ground level fall with a head strike. Very common to see in EMS. It'll be one of your most common. So what do we do? Remember ABCs. BSI. Watch the airway, especially with facial trauma. Blood, chunks of flesh, teeth can block the airway. Any questions? That's ridiculous picture. Any questions? Oh, teeth. So you knock teeth out, if you can find them, grab them, put them in a container with the patient's saliva or some milk. Bring it with you. You'd be amazed what a orthodontist and dentist can do. Pretty impressive. Nose. Lean forward, have the patient lean forward. Try to hold direct pressure, hold the nostrils together. You not tilt the head back. That's how blood goes into the airway. Then you choke and aspirate on it. Don't want to do that. Yes.
How come, well, I mean, I know that's correct and everything, but how come like when I was younger, like my parents always sent me back whenever I could bleed?
Because that's the way they were taught, which was the wrong way.
Oh, okay.
So that's old school. I think the reason why was like they thought the higher elevation, you know, the blood pressure doesn't go all the way up, but there's no physiological reason to do that.
Okay, well, that's.
They found more people choke by doing that. So now it's pinch and lean forward. Ear injuries, stay away from Mike Tyson. That's about the only way to address it, it's that bottom picture. Any questions? Bring the pieces with you. Might be able to reattach it. Ooh, more facial fractures. So this video here, it's the guy that tried to kill himself by putting a shotgun to his face. He blew his entire face off, but he was still very much alive and alert. Yeah, no airway, but it was actually one of the easiest surgeries they did. They brought him in prone. Because otherwise they had him flat, or even Cy Fowler who just started choking on his own blood. But it's a pretty interesting video. Oh wait, this isn't it, sorry. This is good though, this is a broken jaw. Bad choices. Huh?
Dude, you okay?
It's me or something. Ew, blow up his jaw.
Okay, good.
His jaw's broke.
Yeah.
There's teeth.
Oh my fucking god. Oh, let's see. Oh, you can't do this. I think my jaw is well.
I don't think, I know. So yeah, they can do some pretty impressive stuff, getting teeth put back together. All right, here's this one. Oh. You didn't. You didn't. No, I just checked this last week and it was still there. See if somebody reposted it.
You could probably find it on like anything.
Yeah, YouTube bites. This is why I gotta clip stuff when I find it. That's been in here. I've had that video for like 15 years. Clowns. Hold on. Gotta be smarter than the average bear. Sounds healthy. Give me 1 second here. I want to see.
You have to save it to your drive.
Yeah, hold on. I can't remember what chapter this is in the old book. So chapter is it now? Here. No, that's yes. So 25. Yeah.
Ouch.
Yeah. That's not, yeah. That's, yeah. Let's go 26. And.
I wish you could find it on like Facebook.
Try this one. I flipped it and I reposted it to YouTube. But I shouldn't have thrown it on YouTube. I should have thrown it on the drive. That was stupid.
Bring up the car.
Shit. Oh well. Sorry. All right. So blunt trauma to the neck. You have to worry about crushed larynx. That will kill them. You have to get immediate advanced life support. Hopefully, a paramedic can do a trachothoracotomy and get the airway. You will not be able to get the airway with the larynx crushed. That'll be fatal. Diesel, yeah. All right, so the bottom picture's fake, the top picture's real. Yeah. Penetrating injuries does not block the airway, secure place transport. She also has, if you see on the right eye, she's starting to develop what's called a raccoon eye, which is a sign of a basilar skull fracture. So she's got blunt and penetrating trauma to the face and neck. That damn near, I mean, that's right between the carotid jugular vein and the trachea. So she got real lucky that whoever stabbed her was not a good stabber. But they got full penetration. Ooh. Any questions? Look how the agony is in. His shirt's perfect. As trauma patients look at that, their face, their skin's all perfect, their clothes, their hair's done nice. That's always with trauma patients. They don't look like that at all. This should be interesting. Oh, yeah. Marla, check.
Sending the back in front now. Comes back to the line.
So. Let me give you a little background on this. I don't know what it is about Buffalo, New York. But so this arena where the Sharks play is Alton Sharks. The Sabres play is only about, I don't know, 10, 15 blocks from Erie County Medical Center. It's the level 1 trauma center. This happened twice in the same arena, about 10 years apart, where a skate had a carotid artery. The one with Marlachek, the trainer literally saved his life. He went in with his own fingers and pinched his carotid artery, closed it, stopped it from bleeding to death, and held it all the way into Erie County Medical Center. The other guy, can't remember, but then there was one in Europe where they didn't have a trainer at that level of training. He blended. That was the most recent one.
How recent?
I got the one in Europe.
Yeah.
4 or 5 years ago. Wasn't that long ago. Hockey player bleeds to death, Broad 7th. Three years ago.
Back over the line. Here's the bag, on into the Buffalo zone of
I don't have level 1 trauma centers in Europe. This is Malarchek.
Take the car, that is, oh, God.
His carotid's literally going out that trainer right there.
Oh, my God. Just keep away. Oh, my God, what happened? You're watching Sabres hockey.
So he's got his ungloved hand inside his neck, holding his carotid artery closed. And yes, he would have bled to death in under 5 minutes if he hadn't done that. Yeah, he's still alive. This is like 20 years ago. See what Malarchek got. And then it happened again like 10 years later on the same arena.
Save now the 89s at one of your 9 Buick dealers of Western New York. Oh. Yeah, oh boy, this is. I've never seen. Wow.
This is 1989, so
I gotta tell you something.
37 years ago,
You're wondering about athlete being paid.
89.
You can't pay a person enough money to go through what I just watched. Wow. I mean, the blood in the goal crease, it's just, this is unbelievable.
Zednik, which is the next one we watched in 2008.
And I don't even know what happened to Malarchuk.
I didn't even know that.
I don't know what happened to him.
That happened.
Why, but it's like someone just threw, had a bucket of blood and dropped it right in the crease. It happened so fast, hit, it was just a matter of seconds, and it was there. It's not like, you know, it took a half hour. It was just there. All of a sudden, like a bucket was flipped over. Well, there was a big collision in the goal.
19 years later, it happened again.
But it's on the street must have caught Malarchuk, and they took him.
Want to see it again?
That's a story right now. Look at that. Take the car,
You can actually see the carotid just wide open. Complete sever.
Oh my God. Just keep it away.
Alright, so then Zedchek was the next one,
Just forward, Richard Zednik.
Zednik. This was in 2008.
Go ahead, goal on the power play. There's a hit by Jokic on Parker. Oh boy, Zednik, oh my goodness.
God, it's really bad.
Richard Zednik gets so wide open. Oh my God.
He did his own.
Oh folks, this is ugly. Richard Zednik is cut wide open.
You know what?
Oh, it's his neck. What? They got a towel on his neck. Dave Zanobi, the trainer, they're getting him right into the dressing room.
This is
This is very serious.
Buffalo has seen something terrible in past years. Fortunately, Clint Malarchuk
Oh,
is
God.
alive and well to talk about it today, but a carotid artery got cut. And this looks and say that kind of a serious blood from Zednik. Quickly, he went, didn't seem to panic, went right to the dressing room.
That's the doctor there hustling across the ice. Zednik is in the dressing room.
Now, Dave Zanobi was right there receiving him at
The
the bench.
Spriggs, the level 1, they got surgeons in the ER waiting.
The neck, and hopefully was able to identify where the cut was and where the blood was coming from.
That is about as scary as it gets.
As I said, this is many years ago, back in the, well, I think it was back in the early 80s, Clint Malarchuk, the goaltender for the
Late 80s, it was 89,
for the
don't date
Buffalo
yourself.
Sabres was hit with a skate that cut him. And your main artery, his main artery was cut.
All right, well, we were gonna show you the replay of what happened, but we do want to say it is very graphic, so if you do not want to see it, or anybody watching the game, you don't want them to see it, we advise you. This is not a pretty sight, but we are gonna show it to you, what happened to
Yeah,
Richard.
we're gonna
Zednik.
show it anyway, though.
Buffalo.
Thumbs up. Gets his own teammate. There it is, right there.
Yeah, and there you can see.
That's a carotid.
Well. But Marchuk once told me, just.
Spraying like a paintbrush gun.
That was a similar incident where the goaltender from the Marchuk was not able to skate away from the goal.
Any questions? That's the same dude. Yeah. He comes out of well, it doesn't even mess his hair up. Or get his shirt flooded. This is another one. So when you're doing an event standby, you've got to be ready to go. So like in this case, this guy got knocked completely unconscious, no airway. And they're screaming for the medics. God was there. Get the paramedics right now. Any questions?
Yeah. On the neck injury, you really would wrap around the neck and then under.
Yeah, you can't go circumferential and then tighten, because then of course that'll shut the arrow out. So that's why you do the tightening on the armpit,
Okay,
but. The neck injuries I've had, we've just packed and held it with our own hand and just had someone hold it. I've never actually done that.
okay.
I don't think that's truly practical personally, but. If you don't have the manpower. All right, you've been dispatched to a motorcycle crash. What do we do first? Scene size up. PSI is on, your seat is secure. Patient was popping a wheelie when the bike fell over and smacked him in the face. What's next? What? ABCs. He's unresponsive. He's unresponsive. He's got a strong rapid carotid, but he's actively bleeding from the mouth. So what do we do? Suction. Breathing's not adequate, so we suction and BVM. What's the ratio for suctioning to BVM? 15 seconds suctioning, 2 minutes BVM. 15 seconds suctioning, 2 minutes BVM. That will be on the test. Is he a priority patient? It's pale, cool, and moist. Whoops. What's next? What? That is the primary symptom. What's next? I just showed you guys. History. Another responsible for facial trauma. Girlfriend states he has no allergies. She says he takes Paxil for depression. Last meal was lunch. We already know the events leading up to it. Now what comes next? Secondary assessment. Got a fantastic blood pressure. Heart rate's pretty fast. Respirations aren't good though. Eyes don't open, no verbally withdraws from pain. What's his GCS? No. One for, how many for eyes? One. How many for verbal?
One.
1 plus 1 is? How many for motor? Withdraws to pain?
3.
No. 4. So 2 plus 4 is? Got a GCS 6. Got deformity of the nose and mouth. Next, negative palpation. He's got crepitus on the left side of his chest means that it's crunchy. Lungs are clear and equal, everything else is negative. However, on his second set of vital signs, his respirations have actually gotten worse. Good thing you're assisting his ventilation with BVM. Any questions? All right, which of the following statements regarding Adam's apple is false? Is Adam here today?
Yeah.
Is it inferior to the cricoid cartilage? Is that correct? Everybody knows? Not going to pass the test. No, it's not. It's above it, superior. It's formed by thyroid cartilage. Is that correct? No. It's the uppermost part of the larynx. Better answer than A and B. It is more prominent in men than women. That's a better answer. That's wrong. What's the question? Oh, which is false. That's what the other two are good answers, so that is the right answer. The globe of the eye is also called the what? The lens? Orbit? Eyeball? Wait, it's retina, orbit, we're right over retina. Which one is it? The eyeball. When a person is looking at an object, most people do what? They dilate or constrict? Huh? What is it? They dilate and then constrict. What do you do for a chemical burn? Well, that's a good answer. How about immediately cover the injured act? No, because we gotta flush it first, so A is a better answer. Do we avoid irrigating? No, that's not true, so A is still the best answer. Irrigate both eyes simultaneously, even if one eye is not injured, that's a better answer than A. Which of the following signs is least? Remember, people, least. Indicative of a head injury. Asymmetrical pupils. That's a sign of a head injury. Pupils constrict to bright light. Is that what they're supposed to do? That's a better answer than A. Eyes moving in opposite directions. That's a sign of a head injury. So that was a pretty easy one. All right. Let's learn about head trauma. Can't believe it took away my baby. That is so disappointing. All right, head and spine injuries. Thoughts for the day. There's people that say don't sweat the small stuff. People have written books about it. That is literally the worst advice on the planet. Always take care of the small things. No big problem or no big emergency or bad thing that happens comes from one thing. It is always a combination of small unaddressed issues that all come together at the right time together, and then something really bad happens. Any questions? Nitpicky, unattentive people are a pain in the ass, but they rarely have disasters and major problems. Any questions? How many people know about line of duty deaths and fire? Would you say that? How many of them violated one safety procedure? No, I mean just one. None. They always violated like 4 or 5 at the same time. That's what gets you killed. Violating one's not going to get you killed. You violate 4 or 5 at the same time, or like Storm King Mountain, when you violated 11, that will get you killed. So again, take care of the small things. Any questions? All right, so learning about head trauma, head and spine. You got to know the anatomy of the central nervous system, which you already know. We're going to review it. We're going to go over the anatomy of the skull and spine, which you already know, but we're going to review. You are going to learn about the different types of head injuries and what TBI is. TBI stands for traumatic brain injury. And you're going to learn about the 3 H bombs. We're going to go over the emergency cares dealing with a head injury, when to leave a helmet off, when to leave it on, and when to take it off. All right, your central nervous system consists of your brain and spinal cord. All the nerves that come off your spinal cord are your peripheral nervous system. Any questions? And in your peripheral nervous system, you do have what's called a reflex artery. So if you do something really stupid, like stick your hand inside of a flame, it'll automatically pull back. You don't have to wait for the sensory nerves to go to the brain to tell the motor nerves to pull back. Any questions? There's your central nervous system in living color. Any questions?
Congrats.
Yeah.
I don't know if it's someone else's, but it's saying I've gained access for a presentation.
Yeah, presentations 29 to 31, you can't get access to.
What? Stand by while we address this technical difficulty. You gotta be kidding me. By golly, you're right. Hit refresh. Which one, 29 and 31, you said?
29 to 31.
Wow, really? It's kind of a jerk to do something like that. You're the first people that ever say it. Huh?
A refresh on my body.
Can you get in now?
Yeah.
Kind of like God to have powers like that. All right. All right. Get back on it. Good thing you said something. There's that reflex arc we were talking about. Any questions? The reflex arc has no relation to the lost arc. You get Joe fans. So. Your nervous system, your central and peripheral nervous system basically control the entire body. Your sensory nerves, motor nerves, and then involuntary activities. So it goes through your sympathetic and your parasympathetic nervous system. Your sympathetic is your fight or flight, your parasympathetic is all the vegetative functions that run automatic. Well, fight or flight is automatic too. Any questions? Your somatic nervous system is the voluntary. So again, sympathetic, that is your fight or flight. Your parasympathetic is what runs all of your vegetative function, your digestion, your heartbeat, your breathing, all that stuff. Any questions? Remember the spinal cord? Spinal column, not spinal cord. Everybody got knows every one of those vertebrae's names? All right. So the skull. These things are important to understand the anatomy and physiology of the skull. You got 2 layers of bone to protect the brain. Cranium and the face. It's divided up into. And there's no room for error in there. So you got the skull, then you got the brain sac, which is called the dura mater, which is black leather. Then inside the dura mater is your brain floating around in some cerebral spinal fluid. So it starts to bleed from there. There's not a whole lot of room for blood. It starts causing pressure. Same as the vertebrae. So your spinal column has very little room, like I showed you guys in those pictures a couple weeks ago, for blood and pressure. You can crush the spinal cord very easily, which will result in paralysis. So different types of head injuries. You've got scalp lacerations, skull fractures, which can be very serious, brain injuries. Medical conditions are not part of a head injury. I don't know why the publisher has that in there. And then secondary complications of head injuries, things like swelling, bleeding, hypoxia, hypotension, etc. Any questions? All right, scalp has a rich supply of blood, so when it gets cut, it bleeds really bad, but it's usually not life-threatening. However, you have to worry about internal bleeding below the skull. Any questions? I don't think there's anything here anymore. Oh, there is. That's a good one because it's got good sound effects. I used to have an even better one, with a kid running up, hitting another kid in the head with a shovel. The sound effects, it was a great, great video, they took it away. All right. There's 4 types of skull fractures. There's linear, which means it's in place, basically a cracked skull. Then you got compressed, that's when the skull gets pushed in. Then you got basilar, that's the basilar bone, which is what the shell sits on. We're gonna go over some telltale signs. Then there's opal, which is a typo that I have never corrected in over 20 years. So it's be OPEN, open. Open is very, very bad. 80% of those die. We're gonna go over each one of them. All right, 80% of your skull fractures are linear, it's cracked skull. Generally not life threatening, but you have to worry about pressure inside the brain, bleeding in the brain. One of the things is Q contracture, that's when the brain gets knocked back and forth from the blunt trauma. That causes bruising on both sides of the brain. It's called the Q contracture brain injury. Any questions about linear skull fractures? Breaths, it's usually from blunt force trauma, big smack to the head. Usually associates with brain trauma, usually gets some internal bleeding with that inside the skull. And you can also get bone fragments pushed into the brain as it goes through the dura mater. Any questions? Catching on.
The anatomy and physiology of skull fractures.
This isn't that great, but it's important. It's good. Turn the volume up for you.
Penetrate through the skin, the fracture is open. The anatomy and physiology of skull fractures. A fracture in which the bone breaks cleanly but does not penetrate the skin is a closed fracture. When the broken bone ends penetrate through the skin, the fracture is open. Despite bone's remarkable strength, they are susceptible to fractures or breaks all throughout life. During youth, most fractures result from exceptional trauma that twists or smashes the bone. The skull is prone to fracture at certain places such as the thin squamous temporal and parietal bones over the temples, the sphenoid sinus, and the foramen magnum. A linear skull fracture is a break in a cranial bone resembling a thin line without splintering, depression, or distortion of bone. A fracture is greater than 3 millimeters in width and runs through both the outer and inner lamina of skin. A fracture usually runs in a straight line. Remember, a fracture is not a suture. A suture is less than 2 millimeters in width. A suture is very curvaceous and it does not run in a straight line. Temporal bone fractures are encountered in 75% of all skull-based fractures. The 3 subtypes are longitudinal, transverse, and mixed. The most common type, longitudinal fractures, occur in the temporoparietal region and involve the squamous portion of the temporal bone. Transverse fractures begin at the foramen magnum and leave in the middle cranial fossa. Mixed fractures have elements of both longitudinal and transverse fractures. Occipital condylar fracture results from a high-energy blunt trauma with axial compression, lateral bending, or rotational injury. The type 3 fracture, and the most harmful, is an avulsion injury as a result of forced rotation and lateral bending. Flyvus fractures are described as a result of high-energy impact sustained in motor vehicle accidents. These fractures result from a high-energy direct flow to a small surface area of the skull. Most of the depressed fractures are over the frontoparietal region because the bone is thin and the specific location is prone to an attack. A depressed fracture may be open or closed. Open fractures have either a skin laceration over the fracture or the fracture runs to the paranasal sinuses. Open fractures may either be clean or contaminated. In newborns, ping pong, depressed fractures are secondary to the baby's head and injury hits the mother during uterine contractions. The use of forceps also may cause injury to the skull, but this is rare. In addition to the risk of infection and contaminated depressed skull fractures, a risk of developing seizures also exists. Another common fracture is a compression fracture. This is where the bone is crushed. This is most common in osteoporotic bones. This can lead to a condition called cerebral compression. This occurs when there is a buildup of pressure on the brain. This condition usually develops immediately after a head injury.
Any questions? All right, so basilar skull fracture, this is actually a really good drawing. So this is the bottom shelf of the brain. So when that bone gets broken, you'll start getting blood and cerebral spinal fluid will start draining out the ears and into the pooling below the eyes and running out your nose. So bloody nose, eyes get black, they look like a raccoon. That's why they call them raccoon eyes. And then bleeding out the ears or bruising directly behind the ears, which is also known as battle signs. Those are telltale signs. Also, which I hope to God you never have the time to do because you should be loading and going with these signs and symptoms. What it is, there is blood and clear fluid coming out of the ears or nose. If you do take like a 2x2 cotton or a gauze and put it there, if it does that, that's called a halo sign. If the blood goes to the center and the clear fluid goes to the outside. That shows it's cerebral spinal fluid and blood. That's a telltale sign of a basilar skull fracture. It may be on the test. Any questions? That's what raccoon eyes look like. Classic example. Any questions on raccoon eyes? This is a much better example of what it looks like on a human. Number one way of getting a basilar skull fracture is going through someone else's trash. Just kidding. That's right. That's a perfect picture of a battle site. That's real. Any questions? That's blood bleeding down from the skull through the crack in the basilar skull, pooling behind the ear. Another good ones. Classic battle signs. That will be on a test. Any questions about raccoon eyes and battle signs? Any questions about basilar skull fractures? Any questions about compressed skull fractures? Open skull fractures are very bad. If you break the skull open, the skull is a very, very solid bone. And if you take enough trauma to open a skull fracture, that's really bad. And generally, they die.
You showed us the kid jumping out with an open skull fracture.
Yes.
His whole face.
He lived up.
Really?
Yeah. All right, TBI. Traumatic brain injury. This could be a permanent disability for the patient. So if at all possible, you want to stop the secondary effects from traumatic brain injury. There's three things called the 3H box. So you have your primary injury, which is the direct trauma, either blunt or penetrating that damages it. Then you get a secondary injury, which is bleeding from pressure, swelling, infection, and hypotension. So the big three things you have to watch out for in a major head trauma is you don't want to have the 3 H bonds of TBI, and that is hypotension. The reason why hypotension is a problem is when there's increased pressure in the brain, if the blood pressure can't keep up, no blood gets to the brain because there's no pressure. And then the brain dies from no blood flow. Next one is hypoxia, low oxygen saturation. You've got to keep the oxygen saturation up. Otherwise, there's no oxygen in the blood getting to the brain cells die. The third one is hyperventilation.
So back in the olden days, when I first became an EMT, we hyperventilated head trauma patients because hyperventilation causes vasoconstriction because you don't need as much oxygen, so the vessels constrict. And that also brings down the intracranial pressure. So they thought that was a good idea until they started finding out that most people that got hyperventilation didn't end up doing very well later and ended up with major TBIs because they found out that when the brain's already had a major injury and then you cause vasoconstriction to it through hyperventilation, you get less blood flow to an injured brain. So you want to prevent those three things: hyperventilation, hypotension, and hypoxia. Any questions?
That would be a secondary injuries. That's how you prevent secondary injuries. You prevent those three things from happening. So, we talk about bad choices. This is how you get a TBI. This is a very, very bad choice if they didn't take it or that didn't. Is this what it's like? Whoa. You've had this forever. So the idea is, I know this because I used to do this as a kid. He's trying to grab the kid on the bike's pants. Pretty funny. Get your buddy driving, you lean out the door of the back seat, you grab the pants of the kid on the bike. Except he didn't look to see that there was a car coming from the other direction.
Oh my God. Go back. I gotta call you back, dude. Something serious is fucking happening over here. Fuck. What happened? Call an ambulance.
911.
Oh my God. Go back. I gotta call you back, dude.
I should clip that one because we're not gonna take that one away too. So 3 types of secondary head injury that you guys need to know about. So the first one is, remember we talked about the dura mater? That's the sac the brain's held in. So there's bleeding on the surface of the brain, below the dura mater, but on the top of the brain. That causes what's called a subdural, because it's below the dura, subdural. Hematoma, and that's the top picture you see there. And what it does is, it depends on the size of the bleed, it starts slowly putting pressure and crushing the brain like a hydraulic vice. These can come on slowly, they can come on quickly. They can come on the same day, they can come on over a period of months. I had a friend that slipped and fell in a car accident once, solid ice out there, slipped, fell, hit his head. And about a week and a half later, he was working as a dispatcher at the ski park and couldn't think to type the words on the keypad. So he knew something was wrong. He'd been an EMT for like 20 years. So he drove himself to the hospital. Yeah, and he had a major subdural. So subdurals can be life-threatening. They can cause TBI. I also know cases of kids that have had them for 6 months. And I've known adults that have had them that's killed them within 48 hours. Then you have intercerebrals. That's when our artery ruptures inside the brain. Those are always very bad. Very difficult to fix. Usually have a poor outcome. But the one that will kill you the fastest, and is by far the most lethal, is the epidural. And it takes a very small bleed to do it. The reason why is the epidural is outside the dura mater, but below the skull. So you think, oh, well, yeah, it's not on the brain. But the problem is the dura mater is super tough, and the skull is right there. There's literally no room there's no margin for error. So when it bleeds, it starts crushing it from the outside. So it can't absorb into the brain cells like a subdural. So it just kills you quickly. The good news is, and it will be a test question, so you guys need to know it, is there some telltale signs and symptoms of an epidural hematoma. So when someone gets blunt trauma to the head,
gets knocked unconscious. They regain consciousness and then start losing consciousness again. That's the signs and symptoms of an epidural. Because the initial blow to the head is enough to knock them out cold, and that ruptures the artery outside the dura mater but below the skull. Then they wake up. It's like, wow, that was bad. And then as the brain starts getting crushed from the outside, like a hydraulic vice from the bleed, then that's what happens. There's lots of cases of that. This class is good. We've been teaching this for a long time. Everybody used to know who Natalia Richardson is. You guys probably know her husband. He's anti-gun, but all of his movies he's shooting guns. Liam Nielsen. His wife, she was a big time actress. Parent Trap and all kinds of movies. Anyway, yeah, they were skiing in Montreal and she smacked a tree with her head, knocked her out cold, and woke up and ski patrol said, "Hey, we need to get on." She's like, "Oh no, I'm fine. I'm a movie star." Went back to lie down in the bed in the hotel and never woke up again. And that's what it was, epidural. There's a whole bunch of cases like that. As a matter of fact, thanks to a real cool surgeon in Mexico City, where they don't have HIPAA laws, I've got some great videos to show you guys what surgery on a subdural and an epidural looks like, so you can actually see what they are, which is pretty cool. I really like this guy. So this one is an elderly female, ground level claw.
They found a subdural on her CAT scan. So they went in for an emergency craniotomy, but it was too late. She had a major leukemia. So look at that. So this is the brain. The brain's supposed to go all the way around. That is the bleeding below the dura mater, and it's literally crushing your brain. So this is called a midline shift. That's the midline of the two ventricles of her brain. It should go straight down like that. It's completely shifted over. That's very, very, very bad. This is emergency brain surgery. We can see the size of the ischemic bone too. Oh, it's a huge subdural. So he gives her a haircut. Goes the scalp. There it is. Look at that. It's huge. So the bleed, you can see the bleed. It's an arterial bleed. It's squirting like a freaking fountain. So it's going to take an iron, cauterize it. It's going to cauterize it. Those you couldn't see the bleed. It's right here. It's a full stream. Shoot, wow. All fixed.
So when I show you this up at the top, is where it was. How it's.
Well, the problem was yeah, because it was inside the dura mater, which that's the dura mater. He's got cut and moved over to the side here. So it was just crushing the entire brain. So unfortunately, she had a full right side of paralysis. Left side of her brain was pretty much toast. So it got crushed. And went without oxygen for too long, hypoxia. But I mean, man, he did the best he could do. It's too bad.
So. What he pulled out, was that just a giant block?
Yeah, That was the subdural hematoma.
So the blood may flow between the skull and the durabata.
Well, it was the Duramata and the brain there. The skull's on the other side of the Duramata.
Okay. And then it'll just congeal.
Yeah.
It will solidify.
So now this is an epidural, which is outside the Duramata. So the brain is still inside the Duramata, but this is outside the Duramata and it's crushing the brain from between the skull and this is a child. This one's pediatric. 10-year-old. Same surgeon. Mexico City, man. It's one of the biggest cities in the world. That's a huge epidural. Together, that's from the outside of the Duramata. It's crushing her skull, her brain. He put her name on 0 HIPAA. I think he uses a Dremel, if I remember correctly. He goes right, so you can see the linear skull fracture and a rupture to bleed, like I said, on the outside of the Duramata. Yeah, so he just Dremels it right where the bleed is, so he can relieve the pressure. That's the first thing he wants to do is just get that pressure off of there. You can see it's already clotted. It's still putting pressure, it's trying to get the clots out. There we go. Cauterize the bleed. I just cut the scalp, so I get in there to get it. The skull, not the scalp. Just gonna remove it. Now this size of that clot. And that's it, that's outside the Duramata. Get the pressure off the brain. At least he stopped the bleed, but that was the most critical part. And she recovered well, if I remember correctly. He puts the skull back in there, sews it back into place.
It's like tying a shoe.
What about the part that you don't out?
It'll grow back.
Oh,
Make sure she takes calcium. Lots of cheese and milk. She's young, it'll grow back. Probably make her wear a helmet for a while.
is there a point maybe where like this, the bone doesn't like regenerate?
I think the older you get, the harder it is to regenerate anything. Ta-da! Oh, this guy's great. So glad that he puts it out on YouTube.
Does this usually affect like hair growth?
Nah, her hair will grow back. Yeah, Mexico City is a city of 9.2 million people. It's bigger than New York City. They only have 100 ambulances for the entire city. So if you work EMS in Mexico City, you're gonna be busy. Look at that. No complications. Saved her. Second day, she went home. There she is. Pretty cool. Pretty cool. Yeah, so in Mexico City, they rely on what are called hired ambulances. There's no certification, people just show up with ambulances and strictly cash pay. And yeah,
So you can't get on board if you don't have cash?
well, usually what they do is it's totally different than here.
Yeah.
I'm not saying it's better or worse, because there's things about it that are better and things about it that are pretty uncool. But a lot of times they'll work out deals with certain clinics and hospitals. They'll take you there and then they'll get kickbacks from that. That's how they stay alive. If anybody has Apple TV, there's a show called Midnight Family, which is excellent. It's got one season and it's a true story. It's a book that was written and they did a series on it. It was about a family, a guy that ran an ambulance for a while with his son and daughter as the paramedic, himself, his son, his daughter as paramedics, and then his youngest son that they didn't have daycare for, so he just rode along and bags the kids and people and holds. It gives you a completely different perspective. That's pretty awesome. And it's a true story, because there's hundreds of pirate ambulances, because there's just not enough in Mexico to handle the volume. Just the government can't. There's 100 city-run ambulance, city does. And then after that, you're on your own. It's anyone that shows up in a private, there's no licensing, there's no EMT license, paramedics, they're starting IVs, they're doing procedures because there is nobody else. So it's pretty cool to watch. If you ever have to watch, a great show. Let's go over some different types of traumatic brain injuries with the snaps.
The brain is the most complex part of the human body. This 3-pound organ is the seat of intelligence, database of memories, interpreter of the senses, and the director of all movement. Lying in its bony shell and washed by protective fluid, the brain is also the most fragile organ in the body, with the same texture and consistency as gelatin. Within the brain are over 100 billion nerve cells called neurons, sending electrical and chemical signals to and from the body. Each neuron has a cell body, a long nerve fiber called an axon, and projections of the cell body called dendrites. Dendrites extend out from the cell body to receive messages from other nerve cells. Axons in the brain connect neurons with each other, which in turn provide extensive interconnections with other brain areas. Because the brain and its nerve cells are so fragile, sudden rapid movements of the head can cause injuries. During one such injury, called coup contre coup or acceleration-deceleration injury, the brain bounces back and forth against the bony interior wall of the skull. In high-speed coup contre coup injuries, the impact may be violent enough to cause swelling and bruising of the brain tissue, called a contusion. However, in cases involving low-speed coup contre coup injuries, the resulting damage may not be visible to the naked eye. As the brain moves back and forth within the skull, areas of varying density in the brain slide over each other at different speeds. Axons crossing these junctions experience tremendous shearing forces, causing them to stretch and tear from the cell body. This event is called axonal shearing or diffuse axonal injury. Brain damage can continue to occur for hours or days after the initial injury. Damage to the axons can lead to a breakdown of communication among neurons in the brain. The torn axons quickly degenerate, releasing toxic levels of chemicals called neurotransmitters into the extracellular space. In turn, many of the surrounding neurons begin to die over the next 24 to 48 hours, worsening the initial effects of the injury. Mild to moderate cases of diffuse axonal injury, or DAI, may result in symptoms such as brief loss of consciousness, impaired long-term memory, reduced problem-solving ability, lower social inhibition, and problems with attention and perception. Severe cases of diffuse axonal injury may result in coma or a persistent vegetative state. In the United States, over 1 million cases of mild traumatic brain injuries, including diffuse axonal injury, are reported each year.
That's a lot.
Of this number, over 300,000 patients suffer long-term effects from the damage. Computed tomography, or CT, and magnetic resonance imaging, or MRI, are tests that can be performed to check for mild traumatic brain injury. The results of these tests usually show a normal reading. Therefore, doctors must rely on patient history and a clinical exam to diagnose mild traumatic brain injury.
Any questions? All right, spine injuries. You get compressions after a fall, motor vehicle crashes, and distractions can get hung. Any questions? So, this is actually closer to what we do now, but we still at least put C collars on and control scenes. This is
Then how many things can you find wrong in one video of this? This is just amazing. That's a 2-car crash.
I like that seat control. Seat safety there. I like how they're holding seats by the leg in the wrecked car. Get out, walk over here and sit down. Where do you see the casting truck right in the center of the stadium?
That just. Oh my God. This is another one where you have physicians on scene. So this is a major head injury. You'll see his eyes. They actually show his eyes. That's called a dyscognitive gaze. He's got no idea where he is, who he is, what's going on. And I don't know who Joe Torre is, but instead of holding C-spine, Joe Torre keeps putting his hand on his head and pushing his neck and stuff. He keeps grabbing his neck. Yeah. Huh?
Checks out Tori.
Oh yeah, great guy, but probably shouldn't be on the scene of a medical.
Wouldn't that like?
Hey, don't even tell me. If this is hired, I wouldn't blame him for taking it away from me. You hear my kids and the dogs in the background. He's out. Wait till you see the other angles. I was waiting for the Giants getting called. I was like, oh, I gotta steal this for your defense.
And the problem, one of the kids looking at the weird video, like multiple days, like Gator, now low pro.
Boom, fire right to the head.
This is a good angle. Huh? A long time ago. None of these guys play baseball anymore. You see, grab him by the back of the head and push him up. Look at that, look at those eyes. He thinks mom's trying to wake him up for school. 5 more minutes, mom. He's holding his neck. Oh my God. That is not how you should handle this. These guys weren't prepared for a medical emergency either. Yeah, it's all such a big monster, isn't it? Yeah. You gotta remember, that wasn't thought of 150 years ago, they built Fenway. They have, just not that. EMS has never thought of when it comes to renovations, even hospitals. Back in the olden days, you had to wait for your game to come on. You didn't have a game on every channel like you do now. Or on your cell phone. Oh, look who finally showed up. He's still holding his neck.
What's it doing? Dad, what?
Videos. What are you doing, Dad? All right, I know Adam went over helmet removal with you guys. Any questions? You can maintain the airway and breathing. You should probably leave the helmet on as long as you keep the neck in line. Any questions on removing the helmet? Oh, here's a video of it.
All right, in this video, we're gonna be talking about helmet removal. All right, so in order to remove the patient's helmet, it's probably be a time when we're worried about airway vacancy or we need to provide them some sort of breathing support. So we're gonna go, the way we're gonna have this happen is one of our partners is gonna come hold the head kind of from the bottom up to kind of stabilize the spine while we release all the straps that are here. You can either loosen them, or if you can't get them loose, you can just kind of cut them with trauma shears, whatever you have available. So our partner stabilizing the neck, making sure that that's not moving at all. We want to make sure that we keep it in the same position as much as possible, that we're not moving. Okay, so when we're ready, we're going to coordinate with our partner and the patient. I'm going to slide back on the helmet. Partner's going to take all the weight, make sure that it doesn't really move. As soon as it's off, we're going to slide the blanket underneath, just that way the head doesn't move at all from its initial positioning. As we're doing that, we're going to kind of swap. So I'm going to take over holding C spot, and the partner is now going to size and apply the cervical collar.
That was very anticlimactic. All right, kids. If at all possible, I try to mobilize them in their own car seat. They're more comfortable. Pad, tape, that's a great picture right there. That kid looks like how unhappy kids are when you do that to them. He's got a great career as a future actor. Any questions? Do not use an adult backboard on a child and try to pat it with. That ambulance has to do a sudden maneuver or a sudden evac move, that kid's gonna fly out like a torpedo. Use a papoose board or a KED. All right, let's see what you guys have learned. You're dispatched to a fall from a ladder. What do? Scene is safe. Man fell 12 vertical feet from a ladder, landing headfirst on pavement. What's next? Six-year-old male, unresponsive, bleeding from the ears. Got a strong, slow radial pulse. He's bleeding from both ears. He's got blood and broken teeth in his airway. And he is not breathing adequately. So what do we do? Suction and ventilate. Is he a priority patient? What's next? History. Signs and symptoms, unresponsive bleeding from the head. Wife says he has no allergies. Wife says he only takes vitamins. No past medical history. Lunch 3 hours ago. Was working, taking Christmas lights down when he fell off the ladder. What's next? Head to toe. Blood pressure is 196 over 110. So one thing we didn't go over in this, I keep meaning to add it, I keep forgetting, is Cushing's triad. So there'll be test questions on that. Cushing's triad is a sign of intracranial pressure, which will cause traumatic brain injury. Three things a Cushing's triad is high blood pressure, like this, bradycardia, and deep irregular respirations. The blood pressure is 196 over 110. Pulse rate's 36. Respirations are 10 and labored. That is Cushing's triad. His eyes have no response, no verbal, and his arms go like this. What's his GCS? 5. How'd you get 5? Yeah, 113, 5. Head, he's got raccoon eyes developing with battle signs and blood coming from both ears. What type of skull fracture is it? Yep. Rest of his secondary is negative. Second set of vital signs, is he getting worse or better? Getting worse. Any questions? All right, you guys go to break. Be back at 8 o'clock, ready to do tapeems.